To the Ramadan, welcome back to my YouTube channel. As you all know that NEET PG 2020 counseling's results are out. The round 1 provisional result is out today, and I thought that I should make this video because some of you have got your dream colleges, your dream branches, and those who have got pediatrics and were aiming for it, this video is specifically for them, dedicated to them. This is regarding understanding pediatrics. Being a third year resident, I have worked for more than 2 years in the Department of Pediatrics, and there are some things that I feel that you should know now that you have going to join as a resident. So first of all, understanding pediatrics, the core is that you will not be dealing with just tiny humans. They're not tiny adults. They have a whole different physiology. They respond different to the treatment. They respond different to your behavior as well. So first of all, the rank needed for getting pediatrics for by all India quota through general category is around 5K. So getting a rank within 5K in lakhs of doctors is not that easy. You have put in so much effort, and the same effort and dedication is expected during the course as well. So I worked so hard to get this amazing rank, and the same is expected now also. So don't be that much relaxed that the work is done. You need to put in the same effort that you put in during your preparation. So there's a heads up that it's not going to be that easy. You have to put in the similar effort that you put during your preparation time. Now coming on to the syllabus and the curriculum of the course, you'll be having OPD duties, IPD duties, HDU and ICU. In ICU, I mean PICUs, pediatric ICUs. This is the core pediatric section. The second is neonatology, where you'll be dealing with healthy babies. Your NICU duties, where sick newborns would be there, and the postnatal follow-up of these babies. Okay, so now coming on to the duty distribution and duty hours. You all know that it is a hectic branch. At stretch, you will be working for 48 hours, 36 hours, and you must sometimes won't get much time for your personal life, and sometimes you will feel caught up. So be prepared for that. Be prepared to be accommodating for your fellow residents as well. So this is going to be tough. Be prepared for that beforehand, that yes, I will have to stay up at night and work for this much hours. It gets exhausting and overwhelming sometimes, but make sure that you have a good support system during tough times, and somehow make it better by having a good relationship with your colleagues. The last point I want to discuss here is that this is something that many of my colleagues in various other branches also ask. Is it tough dealing with kids? And there's a really mixed reaction from my side, because there are some pros to it, some cons to it. I'll begin with the pros. I have listed out some of the pros. The first is you will get exposure to all the specialties. Obviously, as compared to medicine, where all the super specialty are saturated and they take up their cases, in pediatrics it is not such a case. You will have exposure to all the specialties, be it cardiology, neurology, nephrology, rare diseases, oncology, right? So this is the advantage of pediatrics, that you will enjoy the beautiful field of medicine and further decide for yourself which field you want to go in further. The second is you have maximum satisfaction treating the patient, because you add years to the same life, right? I believe that saving a 85-year-old morbid patient to live for another 5 to 10 years is better than saving a newborn child or a 5 to 6-year-old child that might live up to be a pioneer in his or her field, right? That's completely my opinion. I feel that I want to save such a life. I'm adding years, so I think that gives more satisfaction as compared to a field like a medicine, where most of the patients are moribund and old, right? So that's a pro according to me. You people might have some different opinion. The third point is your patient doesn't speak much, unlike medicine, where you have to listen to unnecessary rants and unnecessary details. Your patient doesn't speak much, you just have to observe your child and elicit you just have to observe the child and elicit the signs, and you don't really have to listen to all those stories, right? The fourth point is the kids, they respond better to treatment as compared to adults. As an intern, I have worked in medicine surgery for the most part of the time, so I believe that I have seen children recover better and they respond better to the treatment as well. So the way they respond to the treatment is really dramatic and really surprising, and you will be really happy to see how they respond. The fifth is there is no compulsion of going for super specialty, unlike medicine or surgery, where there is a compulsion now that you have to do super specialty. Otherwise, there's no much scope. But in case of pediatrics, there is no compulsion as such. If you want to go for super specialty, that's your choice. But if you don't, then core pediatrics is also not that saturated. There are a lot of job opportunities, and obviously working with young children keeps your mind young, and sometimes a smile from a sick patient who has recovered can make your entire day. So it definitely keeps your mind young. Few cons are there as well. The first being less money and recognition as compared to the work you put in, the hard work you put in, which is the harsh truth. You have to live with it, and I feel that the satisfaction compensates for it, but for some it might not. The second point is you have to be there always. Obviously, in the back of my mind, there's still some patients of mine that might be in the ward. I'm physically here, but mentally there. And obviously, whenever I'll receive a call, emergency call, I'll have to receive it, right? So you have to be always there. Your patient doesn't speak much, but their parents do, and they can be really annoying at times. A major part of the pediatrics is just counseling, parental counseling, and sometimes that can be really difficult. And parents can sometimes be really annoying with multiple questions and repeating their questions. So make sure you have that patience to deal with such annoying parents here and there. The fourth point is difficult procedures and IV access. Obviously, when it comes to dealing with kids, it's not that easy to put in cannula as compared to adults. You won't find that big veins. The veins would be tiny, the babies would be tiny, and sometimes you will face difficulty during these procedures. Uh, the second last point is there's too much to read and remember. You know that there is ever changing physiology when it comes to children. No neonate is similar to an infant, no infant is similar to a toddler, no toddler to a school going child, and no school going child to an adolescent, right? And even in adolescent age group, the middle age, the early adolescent period, the middle adolescent period, and late adolescent period is different. So you have too much to read and too much to remember about all this. So be ready for that. And last but not the least is the holistic approach. Just like psychiatrist, you just can't write down medication and get away with it. You have to deal with their nutrition, you have to deal with their parental counseling, the environment at their home, and everything, because all this can affect the growth of a child, right? So you have to look out holistically. You can not just go into the core medicine part, there are other factors associated with it as well. That's it from my side. I have tried to compile all the understanding of the program that you are going to enter. See you on the other side. I hope some of you might be joining my college, SMS Medical College, and I hope you have an amazing time during your residency, and bye bye. See you next time.